I'm Dr. Ryan Stanton, and it's time to find out what's going around. There always seems to be a drug craze in our communities. Over the last number of years, it's been the opioid crisis and heroin. This is still very much the case, but we're also seeing other drugs around and a rapid growth of overdoses from Serenity. This drug was initially seen about 5 to 6 years ago when designer over-the-counter drugs became popular. These drugs were initially legal because they were new substances that were not on the DEA or FDA radar. They were sold in packets at gas stations and convenience stores. Their numbers dropped off as laws caught up and law enforcement cracked down. But we've seen a resurgence in the numbers over the last year and especially the last few months. Serenity is supposed to be synthetic marijuana, but the reactions and complications are nothing like natural THC. It has some action on the THC receptor, but the majority of the symptoms are more consistent with methamphetamines and other hallucinogens. Patients present with severe psychosis, paranoia, hallucinations, agitation, and altered mental status. I've seen abnormal vital signs, muscle breakdown, and many injuries. The symptoms can last from hours to days, occasionally requiring chemical sedation and restraints. The internet is filling up with videos of people after overdosing on these substances, often described as scenes like a zombie apocalypse. The best treatment, of course, is prevention. Parents and families should be active participants with those at risk for drug abuse and addiction, being supportive and helping them get the help and recovery they need. Ask questions and educate yourself on what is out there, especially with our young people. Remember, without recovery, all we do is change the substance. You can join the conversation on Facebook at our What's Going Around page, as well as the StantonMD page. Also, follow us at EverydayMed on Twitter. I'm Dr. Ryan Stanton, and that's What's Going Around.